Today, I'm going to be giving you an overview of systemic sex therapy. This is going to be a brief dive into the field of sex therapy. If you're interested in becoming a sex therapist, I suggest going to the ASECT website, and you will learn so much more and go so much more in depth about all these different topics. But today, I hope to whet your appetite and give you some ideas about what is commonly talked about in the field, and as a general MFT therapist, you can incorporate some of this knowledge into your dealings with couples as you talk about their sexual issues. So, the first thing that you're going to want to remember is that you are a systemic therapist and you don't want to throw out your systemic orientation just because you're dealing with issues of sex. We may be one of the only professionals in our clients' lives that take a circular approach and consider their whole context when we're dealing with their sex issues. Other professionals are just going to take a linear approach in dealing with their issue. They're going to say, you, female client, have vaginismus, and this is your problem. You are afraid, and you have different psychological issues leading to the fact that you cannot let your husband penetrate you, and that is the problem. And that's the end of our dealing with the problem, is that we're going to give you some insert applicators to help you expand your vaginal opening so that you can have sex with your partner. But we're going to take a much broader approach to that. We do, of course, want to consider what doctors and medical professionals have to say about our clients. This is a big part of assessment, and you do not want to forget about those things when assessing your clients. That would be really bad malpractice, and you could get in trouble for that. But you don't want to just that's just not the end to our client's problem. So you're going to want to consider the whole person and the whole systemic, the whole system at play when dealing with your clients. So that also means that we take a holistic approach. We're going to want to look at the whole person. Like I said, have your clients physically examined by a doctor. This also helps create rapport and relationships with doctors so that you can start getting referrals from either general practitioners or gynecologists. That's very helpful. So sexual issues may include physical, relational, familial, emotional, psychological, and spiritual components, as well as many other components. Like I said, we're taking a holistic approach. And as I said before, sexual issues are not just linear, they are circular in their causality. So some hot topics in sex therapy. I got a lot of this information from Drs. Goff and Salkel's presentation for the AMFT RB exam prep, spring 2017 presentation. But some of the main topics that are talked about in sex therapy are the sexual arousal and response cycle by Masters and Johnson. We'll go through those phases in just a moment. Sexual desire is going to be a big thing that you may talk about with your clients. You may have a client come in, perhaps maybe the female is having lower sexual desire than her partner. And as I said before, there's going to be a linear perspective that says, well, female, you're the one with the sexual desire issue. We're going to take a systemic approach that may say, well, it takes two to tango, and we may have a pursue-withdraw pattern here. And due to some of the different things that happened in the beginning of this couple's relationship, or due to some things that happened in this woman's past and also in this man's past, we've got different attachment wounds. We've got different family of origin issues that we're looking at, different religious values and emotional response cycles that are happening every time that this couple interacts that is impacting their sexual encounters. So we're going to want to look at all of those things when dealing with sexual desire. The medicalization of sexual problems. You're going to want to know what medications your clients are on and if they're being treated for any other issues. For example, if you have a diabetic client, their Their medication may impact their ability to have an erection. It may impact their sexual desire. It may impact just a myriad of different things that could have an impact on their sexual issues. And then David Schnarch's quantum model of sexual functioning we'll talk about in a moment as well. But these are just some of the hot topics in sex therapy. Some hot names of sex therapy that you'll want to familiarize yourself with is Alfred Kinsey, Bernie Apfelbaum, David Schnarch, Masters and Johnson, Joseph and Leslie Lopigolo, and Sandra Lieblam. And some common interventions of sex therapy, regardless of theory or model, these are some really popular interventions: is sensate focus, prescribed masturbation, authoritative pronouncement, round table, start-stop technique, squeeze technique, and psychoeducation. I'm not going to go through all of these. I put these here so that you can kind of do some research on your own or learn about what's out there. But I will talk about prescribed masturbation and psychoeducation. One of the main issues that you may encounter with your clients is that they just may be ignorant. They may be unaware of their bodies. They may be unaware of sexual functioning of their partner's bodies. And so you may want to just educate them on that kind of thing. Giving some prescribed masturbation for homework is going to be one of the ways that they can familiarize themselves with what is arousing to them. How does their body work? Where is that other hole that they didn't know the difference between? So that's just going to kind of help them familiarize themselves with their bodies and with their partner's body as well. Sensate focus is another big one. But yeah, these are all really great interventions that you may want to prescribe to your clients to help them with their sexual issues. Masters and Johnson, as I mentioned before, is a big name in the field, and they're the ones that kind of first formulated the sexual arousal and response cycle. Since then, there's been some theorizing and research done that says that the cycle does not have to go in this order, or that they kind of bleed into each other. But the traditional cycle begins with excitement. This is the beginning of arousal, where the couples may be involved in foreplay, and your heart rate goes up, and your body's releasing different chemicals to get you excited. Often erection and clitoral erection will start in this stage of the cycle. Then there's a plateau, kind of a leveling out of this excitement right before orgasm, which is the peak of arousal and excitement and response of the body. You'll have ejaculation and orgasm during this stage, and then there will be the resolution. And the different issues of sex in this theory are going to say that your issues are going to come into play at any one of these different stages. So you may have an issue during the excitement phase where you just can't get aroused, or you may have an issue in the plateau phase. You may have an issue where you don't ejaculate, or you don't orgasm. You're not kind of reaching that peak or pinnacle. Or you may have an issue in resolution. Maybe you've got a couple where the male, he this is kind of crass, but hit it and quit it, where you ejaculate and then you're done. Whereas the female is maybe wanting to snuggle or cuddle after that orgasm, for her to be able to have that resolution and bonding, for her to feel with her partner. And so at any different stage of that cycle, you're going to want to be looking at the different issues. Masters and Johnson's theory of dysfunction that I wanted to bring up here is just the psychosocially imposed obstacles such as ignorance, fear, guilt, and shame that may get in the way of sexual functioning. So this is something that you're going to want to consider with your clients: is their psychosocially imposed obstacles, whether it be their ideas that they have from their family of origin, or their religion, or their culture, different ignorances or or fear or guilt or shame that they feel that may kind of interrupt these different stages of the sexual arousal and response cycle. David Schnarch is again another name that we mentioned before, and he came up with the quantum model of sexual functioning. His theory of dysfunction was that sexual issues have to do with issues of differentiation. So basically what he believed is that couples cannot engage in fulfilling attachment and fulfilling sexual and romantic relationships if they are not themselves individuated, individually mature and unenmeshed, confident and knowing what they believe and what they think and who they are as people apart from their partners. If they don't have that issue dealt with, then they can't offer themselves as full and mature individuals to their partners. So they can't have, if they're not healthy and individuated individually, then they cannot be healthy when offering themselves to their partners, and they can't have healthy relationships with a partner if they're not healthy individually. So his whole model deals with kind of helping couples become differentiated and becoming healthy and confident within themselves so that they can turn towards their partner and have healthy interactions that are not enmeshed. So a lot of the things that he talks about in the sexual cycle of partners is that, you know, if a partner is not differentiated, they may not be able to express to their partner their sexual needs. If a partner is not differentiated, then they may be taking from their partner. They may be abusing their partner emotionally, sexually, physically, to take what they need that they don't have within themselves. They may be begging their partner for more involvement. You may see this as a pursue withdraw pattern, but Schnarch would say that that is based in an issue of differentiation. So if you want to learn more information about Schnarch and his theories or models, you can look at The Sexual Crucible, his book, or I've attached a link there to a PowerPoint that kind of goes more in depth into his theories. Sex education is going to be another main thing in the field of sex therapy. As I mentioned before, you're going to want to know and understand the male and female anatomy. You may want to have some graphics or some anatomical models available in your office to be able to educate your clients on their different body parts and the workings of all of that. You're going to want to familiarize yourself with the different sex positions, and I've listed a link there. That's the online Kama Sutra that kind of gives some graphics that are not too graphic, that your clients, even maybe some of the more conservative ones, would be comfortable looking at, that you can show so that they understand the different sex positions to help maybe spice up their sex life, or help maybe break some of the stereotypes or ideals that they may have in their brain because of cultural or religious values, that maybe the ministry, or I mean the missionary position is the only position that they can have sex in. So knowing sex positions is something that you can educate your clients on. And also the different products and sex toys that are out there. Your clients may or may not be interested in sex toys, but being aware of the toys and products that are out there, even just different lubes, different natural things, different things that need to be stimulated, that partners may be arguing about or may not know about their bodies, that maybe they're not reaching orgasm or not getting aroused because there's not enough foreplay, or because the male and the female don't know where the clitoris is, and that you may need some, manual stimulation there to be able to get aroused and to stimulate the female partner, or the male partner for that matter. Assessment and diagnosis in the field of sex therapy. This is not an extensive list. Once again, this is kind